Switching gears right now, whether students are scheduled to head back to school in person or online, parents are preparing for a unique start to this academic year. Family physician Dr. Rob Danoff of Jefferson Health joins us now with some advice before the kids go back to school. Good morning, Dr. Rob.
Hi, good morning. How are you, Jim?
Doing well, sir. So for students returning to the classroom in person, they'll be asked to wear masks during the day. So what can parents do now to help prepare them?
You know, one of the things right now is just to get the kids just used to wearing these facial coverings, right, if they can do that. And one of the big things is have the kids go with you and go online and look at which type of facial coverings they want. Have them pick it out for them or for the family. And this way they have a big part in it and what they're wearing, you know, as long as it's cool and safe for them to wear and looks okay. Also, make sure that it fits properly. And now's the time to have them start wearing it a little bit more each and every day so they're used to it. And you know, these straps at the end of it, make sure that they know that's what they hold on to when they put it on and take it off, so they're not touching the front of it so they don't get germs on their hands. And lastly, have them take at least 3 to school. Have them put it in a separate plastic bag. The reason being is in case one gets dirty, they have extra ones. So they put the dirty one in one plastic bag and they bring out the clean one from another one.
Can you imagine? For years they just left their winter coats behind. Now they'll be leaving their masks behind. So
right.
What other conversations should parents be having right now to help their kids understand how this year will be different?
One of the things is have a conversation with them. You know, teenagers just say, hey, so what do you know about coronavirus? What do you think? You know, I mean, what are your friends saying? This way you can start a conversation with the younger ones especially. It's important that we reassure them. You know, young kids are going to elementary school. They're more worried about their parents, their grandparents, their friends than they are about their own safety. But talk to them about, look, we want to keep everyone safe. And so we got to keep distant from each other. So we talk about social distancing. We put in their backpack this little kit, right, with alcohol, hand sanitizers, so they have, and also the hand sanitizer wipes. We say, okay, wipe down your desk before you go there. So it's really important to talk to them and also ask how are they feeling about it. Do you have any questions? Because we want to reassure them, let them know that there's a lot of people looking after them, and this way we can keep everyone safe. So the other thing is, instead of high fives and hugging, we do the elbow fives. So we prepare them for social distancing, but we communicate with them.
A lot of kids are off schedule at this point, especially their sleep schedules. It hasn't only been the summer. This has been going on since March. So what should they do to kind of reestablish a routine?
Jim, that is a great point. So we need to start getting them into school sleeping shape. You know, a lot of kids, they like going to bed later and sleeping later. So now it's the time, and it takes 1 to 2 weeks to start getting ready to a new sleep schedule. So every night, put them to bed about 15 minutes earlier and start waking them up about the time they would go to school, or at homeschooling, you would start school. Now, if they have a problem getting to sleep later, still wake them up in the morning. So if they keep on saying, Mom, Dad, I want to go to bed later. If they won't go to sleep later, still wake them up at the right time in the morning. They'll eventually sleep earlier at the end of the day. So basically, start now to get them into a schedule.
Well, Dr. Rob, I've been on this schedule for 4 years and I still haven't figured out the sleep. So one final question, you know, no COVID vaccine right now, but, you know, a lot of folks haven't been to the doctor's office with their kids. What about their regular vaccinations?
Great point. We want to prevent any type of vaccine preventable illness we can. Number one, even though it's not required, the flu shot. We are so highly encouraging everyone to get the flu shot. You don't want to get a double whammy of the flu and COVID-19. So please get your children the influenza vaccine. It's going to be available shortly. Measles, mumps, rubella, get them that vaccination. You know, if they're going to college, get them the meningitis vaccination. So talk to your doctor or healthcare professional what immunizations are needed for my child to keep them safe and get them ready for the school season. So, Jim, that's an important point.
Great advice. Thank you, as always, Dr. Rob. Continue to stay healthy and safe, my friend.